A new set of insurance guidelines for women's health. The new guidelines from the Department of Health and Human Services include a requirement that insurance companies must cover birth control prescriptions with no copay, along with several other preventative health services. Now, supporters say this will make contraceptives affordable for millions of women and also help them prevent unplanned pregnancies. Joining me now to explain more about the regulation is Tracy Brooks. She is the president and CEO of Family Planning Advocates of New York State. Good news for once. I feel like every time we talk, you're like, we're under assault, we're losing our funding. And
which is the case, and I would tell you.
Know. And now you have something good to say. Lay it on me.
I'm going to tell you, not only that, it's finally something good out of Washington. I mean, the last month we have been hearing bad out of Washington. Here's good news out of Washington, especially for women and for our pocketbooks, and that is that all the FDA-approved methods of contraception will be covered without any deductibles or copays. That's outstanding for women. Guttmacher came out with a report that said 98% of women in the United States use birth control at some point in their life during their childbearing years, 18 to 44. 98% of us use it. Now we'll be able to access it with our health insurance without copays or deductibles.
You know what's actually interesting about this is that this was sort of a surprise. There was a recommendation by an independent body that this be done, and the administration moved
quickly,
really fast.
Yes.
Nothing happens fast in Washington
right.
and government at all, and you've been all over. You've worked in Washington, and now you've worked here, and you know. And B, you know, they didn't even give you any warning, and it's a good thing.
Right.
But why do you think that they moved so quickly?
Well, I think the numbers stand on their own. I mean, to start with, this preventative health care list of services that are available without a copay began going into effect 6 months after health care reform was implemented in Washington.
Right. And that includes what, for example?
So, for example, for adults, it includes hypertension screening, screenings for cholesterol and the like, STI screenings for adults. For children, autism screenings, well children visits, hearing and vision, those kind of preventative services. And then the White House asked this independent body to look at a few other preventative services to determine if they should be added. And 8 new ones were added, not only the contraception, but screenings for gestational diabetes, lactation counseling, and equipment that promotes breastfeeding. Really preventative services that help promote healthy families, healthy women, healthy pregnancies, healthy babies.
And the argument here in favor would be it's actually in the long term more affordable. In other words, when you have a pregnancy that you didn't plan, you may choose to terminate it, which is expensive, or you may choose to have the child, and of course having a kid is expensive, so as we know. So that gives people more planning capability, but also enables them to save money, which is all about what we've been talking about in Washington for, I don't know, a month now or something like that.
Well, we're preventing unplanned pregnancies, but the other thing we're doing is promoting healthy pregnancies, because what we do know is pregnancies that are planned, that women are expecting, generally are detected earlier. Prenatal care starts earlier. Women taking care of themselves and their nutrition promotes higher birth weight babies, a lower infant mortality, better outcomes for moms, better birthing for moms. So we know that planned pregnancies have better outcomes both for moms and children.
So opponents would say, and have said, the administration is promoting sex. I'm sorry, I don't write it, I'm just asking. I mean,
Liz, I think the most important part here, I mean, the most important, and I think the most compelling piece here is that 98% of women in the country, regardless of what their religious background is, 98% of women use birth control at some point in their childbearing years.
Right.
And now there is a recognition of common sense medicine, that insurance will cover something that 98% of the women in the United States use.
The
and I think it's
specifically, no, or
all
FDA
approved,
which
so
includes what else?
Just the patch, the UVA ring, emergency contraception, various types of pills. There are pills that let a woman menstruate once a month or once every 3 months. There are a number of methods that work. Some are more effective for different women. I mean, they're just different methods, and some of those methods have copays that are higher. Some birth control pills can be as low as $10. The patch could be as high as $50. Well, if you don't have $50 a month to spend on your birth control, you might choose the pill you have to take every day, the patch you change once a week. I mean, so we're also talking about higher efficacy birth control for women, that women are choosing between which methods based on their budgets.
And what about the idea of, particularly if you're talking about something covering Plan B, which would be emergency contraception, it is not actually a form of birth control per se.
It is a form of birth control.
Well, not that you're supposed to take as a preventative measure, but something that you take after the fact. Is that correct?
No, it's still preventing unintended pregnancy. Plan B is a birth control method. It has nothing to do with abortion, which is what our opponents would like to say.
Right. So don't you open yourself up, doesn't the administration open itself up to criticism in that saying, okay, well, now you can get it without a copay, you can get the pill without copay, you can get all of these things, and therefore, you know, the religious right is going to be unhappy.
98% of women use birth control. I'm just going to say, this is, well, it's not only the talking point, it's the reality of the women in this country. And when it comes to Plan B or emergency contraception, the FDA has determined that that is a birth control method. It is a birth control method. It is not an abortifacient, regardless of how many times the other side wants to say it. It is a birth control method. It's a preventative method.
And so this is obviously good news for you guys. And
it's good news for women across the country.
And there are... it's actually going into effect when, specifically?
So this will affect all new plans after July, that come into effect after July 2012.
Right.
So today, you won't stop paying your copay. If your health insurance is provided and it's a plan that existed today, and next year your employer or wherever you buy your health insurance keeps the same plan, that plan is grandfather claused in. So it's all new plans after July 1st, 2012 that will be required to carry this preventative service free.
So if I don't switch my insurance and my employer doesn't switch my insurance, this does not impact me.
Right. Okay. Not right away. Yep.
Gotcha. Okay. Well, I want to thank you very much, and I feel like congratulations, because you're here to tell me something that you think is a victory, and that's positive.
I love having good news with you, Liz. It's fabulous. Thanks for having us on. We do appreciate it.
It's my pleasure.